Chapter 6, Growth and Development. Okay, with the rebranding of the book, there's now chapter 6, which is Communicable Diseases, but I don't have a PowerPoint for that, so we're just going to walk through this real quick. Just thinking about some of the communicable diseases that we have and that the baby needs to be immunized against, and the immunizations for infants, children, and adolescents. So just walking through this chapter, you can see that immunizations are going to cause some mild fever and soreness and redness at the site. We discuss with the parents the appropriate doses of Tylenol, but you really want to let that reaction happen unless they're really uncomfortable from the pain. The whole purpose of that is not to decrease the immune reaction. So you wouldn't want to do that. You can always put a warm compress on it, but you want that natural immunity to occur by having that reaction to the shot. So most of the times it's not going to be a problem. Don't have them come into the office for that. And if the child is sick at all, we're going to hold off on those immunizations until they're later not sick. So the next appointment would be fine. You do have to obtain permission and give them the VARS sheet. The VIS sheet, VIS, is the vaccine immunizations. It tells you the risks and the benefits of getting every single vaccine. So we do need to document the route and the site, and that usually goes also into the state's file so that we know how many babies have been immunized at any time. So immunizations from birth to 18, really the only thing you need to do is go grab this CDC chart, and it's right here in figure 6.1. Basically, any severe allergic reaction to any other previous vaccine will probably be a contraindication to doing it. Okay. So right at birth, they get a hepatitis B shot. If the mom is hepatitis B positive, then the baby's also going to get an immunoglobulin shot. Okay, so right at birth, they start. So then the next dose is at 1 to 2 months of age, 9 to 12 months of age, and then they're done, the 3 series. If a dose is missed, the series does not have to be restarted. It should just be continued. Hepatitis A, unless they're traveling, they're not going to really be at risk for that. But hepatitis A is given to children 12 months or older. It's not given before 12 months of age, and 2 doses are given at least 6 to 18 months apart. Diphtheria, pertussis, this is the whooping cough shot. 4 doses are given at 2, 4, 6, and between 15 and 18 months. You are going to need to know these other than memorizing the chart. I'm not sure how you're going to remember all these other than they're usually at 2, 4, and 6. And then another series right before school around age 4. The flu shot, Hib shot, Hib shot is a bacteria that causes the infection in the body. It can cause meningitis. So that's given again at 2, 4, 6, and 12 to 15 months. Rotavirus is a live attenuated virus. Rotavirus causes severe dehydration and diarrhea. 2 vaccines are needed. The biggest thing about this is that if there is a history of intersusception, which is the bowel going back in on itself, then you would not want to give this baby this shot because it's a more risk to happen. So a small increased risk of intersusception exists with this shot. So if they tell you at all that the baby had been hospitalized for intersusception, you would hold this shot. Pneumococcal, so pneumonia shot, given to children less than 5 to protect them against pneumococcus. The 13 replaced the 7, and it's usually recommended at 14 to 59 months. 4 doses are given again, 2, 4, 6, and 12 to 15. It does protect from meningitis, otitis media, and other infections. So if the patient were to have a cochlear implant or sickle cell anemia, they may go ahead and give it, especially because of the special medical need. Poliovirus, again, 2, 4, 6, and between 18 and 4 to 6, so again during school. Influenza, the flu shot, 6 months minimum, so that's always a test question. They have to be between 6 months and 18 years to get that shot annually. And again, this is for anybody who has immune system issues. The very young and the very old are always at risk. So we're going to give a live attenuated vaccine. You can give it as a nasal spray versus the injection. I believe the nasal spray now is off the market. Measles, mumps, rubella, so your rubella shot, again, if you just think about the first one is usually at 12 months. Don't give before the first birthday unless they're traveling outside. The second dose is usually given at 4 to 6 years. If they're immunocompromised or anything like that, you would want to contraindicate that. So someone on the list for a transplant rejection, transplant. A TB test may be given before or at the same time or 28 days after the MMR, just in case they came up positive. Varicella is an attenuated virus. Again, if they're immunocompromised, you wouldn't want to do that. So immunodeficiency, those people who are pregnant or a family history of immunocompromise, you would not want to do that. But the baby gets it at 12 months, so do not give before the first birthday, and then again at school age 4 to 6. You may get a little one or two. It's not abnormal to get 1 or 2 chickenpox at the site of the injection, and that wouldn't keep them home from school. You would just put a Band-Aid over that. Meningococcal, again, at risk for meningitis. Diphtheria, pertussis, this is a DTaP. Because of immunity waning around 11 or 12, they get another shot, usually also before college. All pregnant adolescents should receive a DTaP during each pregnancy, regardless of the time since the previous vaccine. It is contraindicated in anyone who has an adverse reaction. The Gardasil shot, that's usually recommended from 11 to 12 years of age. The minimum age is 9, and it's a 2-dose series with at least 6 months in between each dose. If it has not begun before 15, then they will get 3 shots. Again, the most common side effect is syncope, so that you should have them sit in the office for 10, 15 minutes before and after they get the shot. Okay, that is also recommended for boys too, not just girls. And then your immunity types, your active immunity and your passive immunity. The vaccines, just remember you're live, attenuated. You would not want to give if they're pregnant or have issues with immunocompromised. So just the routes of most vaccines are going to be IM, and then just reducing the fear. In immunizations, we tend to do both shots at once. Physical exam before the shots, they're usually coming in anyway, so you're just looking for any vomiting, fever, diarrhea, anything like that. You would not want to do that. Any adverse reactions are in here. So just know these diseases, the hand, foot, and mouth disease is very common and it incubates in 3 to 6 days. It can be shed for several weeks. This is a direct contact. This is usually when mom's eating the yogurt right after the child ate. They spread it from hand to foot. It's usually blisters in the mouth. So you can look through this. The RSV shot, the RSV vaccine is incubated in 4 to 6 days, and viral shedding is for 3 to 4 weeks, or 3 to 8 days in older person. This can happen in NICU kids, and that's why most of them will get the Synergist vaccine before they go home. So just remember, if you're bringing home a baby from the NICU, it's probably worth getting the whooping cough shot for mom and grandparents. So other than that, strep throat quite a bit, you'll see that as well. And again, 10 days to 24 hours after the antibiotics are started, they can go back to school. But it's in respiratory droplets. The problem with strep throat, if it's not treated, it can lead to scarlet fever, but it can also lead to rheumatic heart disease. So you definitely want to do that. These days, the varicella zoster takes care of chickenpox, but otherwise, until all vesicles have crusted over, they need to stay home from school. So just make sure you go through this. Any rash that is spreading quickly is probably petechiae. You would want them to come in. Anytime there's petechiae on a test question, they need to come in. Bulging fontanelles or seizure activity, again, they need to come in. Lethargy, withdrawn, being unresponsive, fever with a head or a stiff neck, vomiting blood or blood in the stools. These are all things that you need to have them come in for. Coronavirus, again, we now know that this passes the placenta, which is an abnormal. So a lot of babies are not making it to term, and they are fetal demise in this point in time. So the big thing's just making sure that we're doing the appropriate isolation precautions. Make sure you go back through this table. There will be test questions on this, contact, droplet, or airborne precautions. Also remember that a nurse who is pregnant needs to protect herself from this because her baby will have genetic disorders from being around that. So you definitely want to know which ones they can be around and which ones they can't. Fifth disease, erythema infectium, is fifth disease because it's historically classified by a fifth common rash in children, and it's from 5 to 15. What happens is this is a limited viral infection, but it has a lacy, persistent rash several weeks after the initial infection. So when you see this child, they look like they've been slapped on the face. That's why it's called fifth disease, like a hand mark. The hand mark is on their cheek. When you see the rash, they're already past the point of infecting someone else. Okay? So the test question will ask you, if you see this rash, do you need to rush to the doctor? No, it's too late. Okay, it comes from human parvovirus B19, so that's why it's important in the test question to be aware that B19 is going to have an issue if the mom or the family member is pregnant. They can't go in that room. That's going to get spread to the new baby. So they love to ask this question. Again, it's contagious until the rash appears. So it's not when the rash appears, it's until the rash appears. So if somebody's calling in saying that they have red cheeks, it's too late. Whoever they've been around is now infected potentially. So we can do blood tests for that, but basically it's self-limiting. Sickle cell disease could happen in the susceptible person, so you want to make sure that you get them into the hospital for a plastic crisis. But otherwise, fifth disease is pretty much self-limiting. 50% of pregnant women have had fifth disease and are already immune to it. But if they're not, you definitely need the blood test to make sure. And foot and mouth disease, again, very common in kids. Incubation 3 to 6 days, and it's a fecal oral direct contact and droplet transmission. So changing diapers and not washing your hands, small vesicles appear in the mouth and the hands and the soles of the feet. They may also appear in the genitalia or the buttocks as well. So you do get swabbed for that. It's careful hygiene, over-the-counter sprays and mouthwash for the mouth pain, acetaminophen and ibuprofen, give bland foods, soak all toys in water with bleach. So you can see through here hepatitis A, hepatitis B, hepatitis C, liver, hepatitis A, fecal, oral route, hepatitis B, blood. So just consider those things when you get to the test. Influenza, just like the adult, the problem is that they can have more problems because they're smaller. So getting vaccinated, fever, chills, self-limiting for the most part. So treating influenza, usually self-limiting. You might get Tamiflu if you catch it in time. Mononucleosis is usually called the kissing disease, and that's because it's transmitted through mostly spit, common for kids of all ages, especially in college when you are away from your parents for the first time. It's a self-limiting disease that lasts a few weeks, but it can lead to chronic fatigue syndrome. So again, enlarged cervical lymph nodes, pharyngitis, splenomegaly and hepatomegaly are the biggest issues. So these kids go back to school, they need a gym note not to be in gym because the likelihood that they burst their spleen or their liver during contact sports is real. So that's always a test question. You have a positive monospot, and that's why they'll put you on EVV, antibody titers, hospitalization if respiratory distress, but again, unless their spleen ruptures, they're going to be just fine. Again, no contact sports to 6 to 8 weeks because the spleen is so enlarged. Rest, quiet activities, play, fever management, nutrition, hydration. And then these kids, if they're going to be out of school, need to have their schoolwork delivered to them. Mumps, measles, mumps, rubella, all in there together. RSV, again, adults can get it as well, but 3 to 6 weeks after the illness. This is a respiratory virus infection that happens every winter. We usually end up having to cohort the children together because there's so many of them on the pediatric unit. It's really self-limiting. It's more the respiratory distress that's going to occur. Poor air exchange, so they might have issues if they were a NICU kid. Especially, they might go back on oxygen. Cool, humidified air, contact isolation gowns. Self-limiting for the most part. Again, it's just a really bad cold. Synergist is the vaccine that we give the babies in the NICU before they go home, especially those born less than 29 weeks. If they have chronic lung disease or preterm at 32, they're definitely going to need that. So just watching and listening for the signs of respiratory distress. I can't tell you how many times this is on the test. So, respiratory distress on kids sounds like restlessness, anxiety, respiratory rate over 60 in an infant, over 40 in a toddler. Retractions, wheezing, I swear, anytime you hear retractions, grunting, flaring, all of that is bad things. Wheezing and distress that increases when lying down, breathlessness, gasping, continuous coughing, nasal flaring, just key, dusky around the mouth, pallor, crowing sound when taking a breath, a hoarse cry, or a barking cough. Those are all going to be signs of respiratory distress. The barking cough is a seal-like cough, and that's going to be your whooping cough. Not a big deal, just needs to be in the ER so that we can put them in humidified air. So a lot of moms just are told take them in the shower. All right, roseola, rose-colored rash, roseola. Usually resolves within 3 to 7 days, a rose-colored rash throughout the body. Again, saliva is the carrier, high fever, but that's your roseola rash. And we'll talk more about that in cutaneous diseases. The German measles, again, just looking down through here, measles, 7 days. Incubation period is 8 to 12. And this is your Koplik spots. So the Koplik spots happen. And measles. So if you see that on a test, Koplik spots are for measles. Otherwise, most of this is going to be acetaminophen and ibuprofen, keeping the fever down, keep the child isolated until after the rash, give bland foods, keep well hydrated, and use a cool mist humidifier. Chickenpox, again, crusting. You don't see that as much anymore because of the shot, but if you were to see them, they would be little chickenpox. The new disease now is monkeypox. It's very similar, but that's from a sexual nature. So it's usually sexual contact that causes monkeypox, not necessarily chickenpox. So we'll use calmaline or oatmeal powder in baths to keep them. Rye syndrome is one of the life-threatening things that you need to remember. No aspirin. So aspirin is sometimes a hidden ingredient in some things like Pepto-Bismol. So you just want to be careful with that. You don't want any aspirin in a kid less than 12. Ibuprofen shouldn't be given to kids less than 6 months because they're immature renal system. So just remind yourself of that. And just hand hygiene, hand hygiene, hand hygiene. Conjunctivitis, pink eye, normal to occur. It's a bacteria in the eye. The big thing to remember is not touching the eye and then touching the other one because it's going to spread like wildfire and throughout the whole house. So if you give them a washcloth to get the gunk out of their eye, make sure they have a different washcloth for the other eye. This biggest thing is contact with discharge from the infected eye. So watery eyes usually have lots of pink discharge and pussy discharge. Whooping cough, like we said, pertussis, that whoop sound, so they go in a mist tent. And then just looking for dehydration. Any signs of dehydrations, the kid needs to come in. How do I know if they're dehydrated? Lethargy, no tears when crying, fewer than 5 or 6 wet diapers in a 24-hour period, sunken eyes, not elastic skin, poor skin turgor, and a sunken fontanelle. The fontanelles are the window to the world with kids. So as long as you see them bulging, you're better off than sunken, but bulging can also be hydrocephalus. So you just have to be careful about that. Strep throat, scarlet fever, we talked about, can cause strep throat can cause a rash. It can also cause scarlet fever, which is a strawberry tongue and scarlet fever on the test. You can get glomerulonephritis or rheumatic fever from untreated strep throat. So the big things are administration of penicillin or amoxicillin as ordered. Keep the kid hydrated with soups, popsicles, milkshakes, something that will be able to go down. Anytime there's something in the mouth, think about replacing the toothbrush and use throat lozenges for the pain. Keep their immunizations up to date. And that's a little bit about communicable diseases.